Chronic lymphocytic leukemia is a cancer that affects the blood, the bone marrow and the lymph nodes. We see it more commonly as people get older. Almost half of patients, the disease comes to light when they have a blood test done for another reason, a cholesterol checkup with their GP, for example. When chronic lymphocytic leukemia causes someone to become unwell, they may feel tired because they're anemic. They may begin to lose weight for no reason, or have large or painful glands in the neck, under the arms, or elsewhere in the body. Patients with chronic lymphocytic leukemia at the early stage of disease are managed with what we call active surveillance, or watch and wait. So this means that they don't get CLL-directed therapy or specific chemotherapy in the early stage of disease. What we advise patients to do with this early stage disease is to take some precautions to protect themselves from infections, like the flu vaccination each year, and then the pneumonia vaccination at 5-yearly intervals. The reason we manage early stage patients in this way is that some patients with early stage disease have early stage disease for many years, in that the disease doesn't always get worse over time. Previous studies that used chemotherapy for patients with early stage disease who were relatively well at the start of treatment didn't show any benefit to the patients of early intervention. The perceived wisdom has been handed down for many years is that patients with early stage disease don't have any symptoms. But I think one of the important things that this report highlights is that that doesn't hold true. And about 8 out of 10 patients with early stage CLL do have symptoms, most commonly fatigue, frequent infections, and concerns around their illness. This report, I think, will be a really useful guide for patients because it explains not only about the disease, about what watch and wait means, but also about where to seek additional help and support and where to get good quality information about the disease.